Chapter 68, Emergency and Disaster Nursing. Question: During the primary assessment of a victim of a motor vehicle collision, the nurse determines that the patient is breathing and has an unobstructed airway. Which action should the nurse take next? Answer is observe the patient's respiratory effort. Even with a patent airway, patients can have other problems that compromise ventilation, so the next action is to assess the patient's breathing. Next, during the primary survey of a patient with severe leg trauma, the nurse observes that the patient's left pedal pulse is absent and the leg is swollen. Which action will the nurse take next? Answer is start normal saline fluid infusion with a large bore IV line. The assessment data indicate that the patient may have arterial trauma and hemorrhage. When a possibly life-threatening injury is found during the primary survey, the nurse should immediately start interventions before proceeding with the survey. Although a complete blood count is indicated, administration of IV fluids should be started first. Completion of the primary survey and further assessment should be completed after the IV fluids are initiated. Next, after the return of spontaneous circulation following the resuscitation of a patient who had a cardiac arrest, therapeutic hypothermia is ordered. Which action will the nurse include in the plan of care? Answer is apply external cooling device. When the therapeutic hypothermia is used post-resuscitation, external cooling devices or cold normal saline infusions are used to rapidly lower body temperature to 89.6 to 93.2. Because hypothermia will decrease brain activity. Assessing mental status every 15 minutes is not needed at this stage. Sedative medications are administered during the therapeutic hypothermia. Next, a patient who is unconscious after a fall from a ladder is transported to the emergency department by the emergency medical personnel. During the primary survey of the patient, the nurse should obtain a Glasgow Coma Scale score. The Glasgow Coma Scale is included when assessing for disability during the primary survey. Next, a 19-year-old is brought to the emergency department with multiple lacerations and tissue avulsion of the left hand. When asked about tetanus immunization, the patient denies having any previous vaccinations. The nurse will anticipate giving TIG and tetanus, diphtheria, toxoid, and pertussis vaccine, or the Tdap. For an adult with no previous tetanus immunizations, TIG and Tdap are recommended. Next, a patient who has experienced blunt abdominal trauma during a motor vehicle collision is complaining of increasing abdominal pain. The nurse will plan to teach the patient about the purpose of abdominal ultrasonography. For patients who are at risk for intra-abdominal bleeding, focused abdominal ultrasonography is the preferred method to assess for intraperitoneal bleeding. An MRI would not be used. Peritoneal lavage is an alternative, but it is more invasive. An NG tube would not be helpful in diagnosis of intra-abdominal bleeding. Next, a patient with hypotension and an elevated temperature after working outside on a hot day is treated in the emergency department. The nurse determines that discharge teaching has been effective when the patient makes which statement? Answer: I should drink sports drinks when working outside in hot weather. Electrolyte solutions such as sports drinks help replace fluid and electrolytes lost when exercising in hot weather. Salt tablets are not recommended because of the risk of gastric irritation and hypernatremia. Antipyretic medications are not effective in lowering body temperature elevations caused by excessive exposure to heat. A patient who is confused is likely to have more severe hyperthermia and will be unable to remember to take appropriate action. Next, a 22-year-old patient who experienced a near-drowning accident in a local pool but now is awake and breathing spontaneously is admitted for observation. Which assessment will be most important for the nurse to take during the observation period? Answer is auscultate breath sounds. Because pulmonary edema is a common complication after near drowning, the nurse should assess the breath sounds frequently. Next, when planning the response to the potential use of smallpox as an agent of terrorism, the emergency department nurse manager will plan to obtain adequate quantities of vaccine. Smallpox infection can be prevented or ameliorated by the administration of vaccine given rapidly after exposure. Next, when rewarming a patient who arrived in the emergency department with a temperature of 87 degrees Fahrenheit, which assessment indicates that the nurse should discontinue active warming? The answer is the core temperature is 94 degrees. A core temperature of 89.6 to 93.2 degrees Fahrenheit indicates that sufficient rewarming has occurred. Dysrhythmias, hypotension, and shivering may occur during rewarming and should be treated but are not an indication to stop rewarming the patient. Next, when assessing an older patient admitted to the emergency department with a broken arm and facial bruises, the nurse observes several additional bruises in various stages of healing. Which statement or question by the nurse is most appropriate? The answer is, do you feel safe in your home? The nurse's initial response should be to further assess the patient's situation. Tell the patient not to return home may be an option once further assessment is done. A social worker may be appropriate once further assessment is completed. Next, a 20-year-old patient arrives in the emergency department several hours after taking 25 to 30 acetaminophen tablets. Which action will the nurse plan to make? Answer is give N-acetylcysteine. N-acetylcysteine is the recommended treatment to prevent liver damage after acetaminophen overdose. The other actions might be used for other types of poisoning, but they will not be appropriate for a patient with acetaminophen poisoning. Next, a triage nurse in a busy emergency department assesses a patient who complains of 7 out of 10 abdominal pain and states, I had a temperature of 103.9 degrees Fahrenheit at home. The nurse's first action should be to assess the patient's current vital signs. The patient's pain and statement about an elevated temperature indicate that the nurse should obtain vital signs before deciding how rapidly the patient should be seen by the healthcare provider. A urinalysis may be appropriate, but this would be done after the vital signs are taken. The nurse will not give acetaminophen before confirming a current temperature elevation. Next, the emergency department triage nurse is assessing 4 victims involved in a motor vehicle collision. Which patient has the highest priority for treatment? The answer is a patient with paradoxic chest movements. Most immediate deaths from trauma occur because of problems with ventilation, so the patient with paradoxic chest movements should be treated first. Face and head fractures can obstruct the airway, but the patient with facial injuries only has lacerations. The other 2 patients also need rapid intervention but do not have airway or breathing problems. Next, the following interventions are part of the emergency department protocol for a patient who has been admitted with multiple bee stings to the hand. Which action should the nurse take first? Answer, remove the patient's rings. The patient's rings should be removed first because it might not be possible to remove them if swelling develops. The other orders should also be implemented as rapidly as possible after the nurse has removed the jewelry. Next, the gastric lavage and administration of activated charcoal are ordered for an unconscious patient who has been admitted to the emergency department after ingesting 30 lorazepam tablets. Which action should the nurse plan to do first? The answer is assist with intubation of the patient. In an unresponsive patient, intubation is done before gastric lavage and activated charcoal administration to prevent aspiration. Next, a 54-year-old patient arrives in the emergency department after exposure to powdered lime at work. Which action should the nurse take first? The answer is brush off any visible powder on the skin and clothing. The initial action should be to protect staff members and decrease the patient's exposure to toxin by decontamination. Patients exposed to powdered lime should not be showered. Instead, any or all visible powder should be brushed off. Next, an unresponsive 79-year-old is admitted to the emergency department during a summer heat wave. The patient's core temperature is 105.4 degrees, blood pressure of 88/50, and a pulse of 112. The nurse initially will plan to apply wet sheets and a fan to the patient. The priority intervention is to cool the patient. Antipyretics are not effective in decreasing temperature in heat stroke, and 100% oxygen should be given, which requires a high flow rate through a non-rebreather mask. An older patient should be at risk for developing complications such as pulmonary edema if given fluids at 1,000 milliliters an hour. Next, a patient is admitted to the emergency department after falling through the ice while ice skating. Which assessment will the nurse obtain first? The answer is breath sounds. The priority assessment relates to ABCs and how well the patient is oxygenating. So, breath sounds should be assessed first. The other data will also be collected rapidly but are not as essential as the breath sounds. Next, following an earthquake, patients are triaged by emergency medical personnel and are transported to the emergency department. Which patient will the nurse need to assess first? The answer is a patient with a red tag. The red tag indicates a patient with a life-threatening injury requiring rapid treatment. Other tags indicate patients with less urgent injuries or those who are likely to die. Next, family members are in the patient's room when the patient has a cardiac arrest and the staff start resuscitation measures. Which action should a nurse take next? Answer is ask the family members about whether they would prefer to remain in the patient's room or wait outside the room. Although many family members and patients report benefits from family presence during resuscitation efforts, the nurse's initial action should be to determine the preference of these family members. The other actions may be appropriate, but this will depend on what is learned when assessing family preferences. Next, a 28-year-old patient who has deep human bite wounds on the left hand is being treated in the urgent care center. Which action will the nurse plan to take? Answer: teach the patient the reason for the use of prophylactic antibiotics. Because human bites of the hand frequently become infected, prophylactic antibiotics are usually prescribed to prevent infection. To minimize infection, deep bite wounds on the extremities are left open. Rabies immune globulin might be used after an animal bite. Initial treatment of bite wounds include copious irrigation to help clean out contaminants and microorganisms. Next, the urgent care center protocol for tick bites include the following actions. Which action will the nurse take first when caring for a patient with a tick bite? Answer is use tweezers to remove any remaining ticks. Because neurotoxic venom is released as long as the tick is attached to the patient, the initial action should be to remove any ticks using tweezers or forceps. Other actions are appropriate but are not the priority. Next, when preparing to cool a patient who is to begin therapeutic hypothermia, which intervention will the nurse plan to do? The answer is assist with endotracheal intubation, insert an indwelling urinary catheter, and begin continuous cardiac monitoring. Cooling can produce dysrhythmia, so the patient's heart rhythm should be continuously monitored and dysrhythmias treated if necessary. Bladder catheterization and endotracheal intubation are needed during cooling. Sympathomimetic drugs tend to stimulate the heart and increase the risk for fatal dysrhythmias, such as ventricular fibrillation. Patients receiving therapeutic hypothermia are comatose or do not follow commands, so restraints are not available. Next, are not available, are not indicated. Next, the emergency department nurse is initiating therapeutic hypothermia in a patient who has been resuscitated after a cardiac arrest. Which actions in the hypothermia protocol can be delegated to an experienced licensed practical or vocational nurse? Answer: place cooling blankets above and below patient. Give acetaminophen 650 milligrams per nasogastric tube and insert rectal temperature probe and attach to cooling blanket control panel. Experienced LPN LVNs have the education and scope of practice to implement hypothermia measures and administer medications under the supervision of a registered nurse. Assessment of neurologic status and monitoring the heart rhythm require RN level education and scope of practice and should be done by the RN. Next, the following 4 patients arrive in the emergency department after a motor vehicle collision. In which order should the nurse assess them? Answer: a 21-year-old with multiple fractures of the face and jaw, a 74-year-old with palpitations and chest pain, a 43-year-old complaining of 7 out of 10 abdominal pain, and a 37-year-old with a misaligned left leg with intact pulses. The highest priority is to assess the 21-year-old patient for airway obstruction, which is the most life-threatening injury. The 74-year-old patient may have chest pain from cardiac ischemia and should be assessed and have diagnostic testing for this pain. A 43-year-old patient may have abdominal trauma or bleeding and should be seen next to assess circulatory status. The 37-year-old appears to have a possible fracture of the left leg and should be seen soon, but this patient has a least life-threatening injury.